What does the presidency mean to you personally?
Well, it means a very great deal to me personally, mainly because I know that my peers in radiology and clinical oncology have elected me to that role and have faith in me to try my very best to preserve professionalism in our disciplines and to support the standards of training and clinical practice in these very difficult times in the NHS with severe problems in funding and staffing.
So what are the key challenges facing the RCR and how do you intend to deal with them?
Well, I think those challenges all revolve around trying to maintain professional standards in our disciplines and to ensure that our standards of practice, clinical practice and training are maintained despite the severe underfunding of the NHS and the very serious lack of radiologists and clinical oncologists in the UK. Of course, trying to tackle those issues is a very difficult problem and there are no easy answers. But I think that between us, all of us, we have to try our utmost to raise the profile of our disciplines so that everybody knows what we do. And that means the government, it means the health ministries of the 4 devolved nations, it means the general public, and it means our clinical colleagues as well. I think that by understanding that imaging is fundamental to the whole of clinical medicine and surgery today, and that clinical oncologists are fundamental to the whole of cancer care, will help them understand why this severe shortage of radiologists and clinical oncologists is so crippling to the whole of British healthcare.
So how can that situation be improved?
We have to really continue to wage a war of attrition in getting our voice heard and in making representations to those in power, explaining all those reasons why we need more radiologists and more clinical oncologists. Of course, we also have to help ourselves, so we have to do things that will at least ease our workload where we can, because we have an exponentially increasing workload in both radiology and clinical oncology. Some of the things we can do have been summarised in a document on the website about the future sustainability of radiology. I'm thinking about things like introducing the possibility of flexibility and working from home, making sure that we utilise any radiologists who want to work part-time or who are recently retired. And then I think we need to think about, where we can, new ways of working and new ways of practicing. And that will mean being open to making appointments perhaps for several different organisations, different trusts, and also importantly trying to introduce networking teleradiology platforms for insourcing within the NHS between local trusts in difficulty, because that will help radiologists for their on-call work, for their general work, for their specialty work.
What difference does the RCR make to patient care and patient well-being?
Well, although the RCR is a relatively small Royal College, it's important to remember that the disciplines it represents are absolutely fundamental to the whole of modern healthcare. And when you think about it, there isn't a single aspect of modern medicine or surgery that doesn't depend in some way on imaging, be that trauma or A&E or stroke treatment or acute bleeding. Imaging is involved in just about every aspect of the whole of modern healthcare. Also, I think it's important to realise that we really represent the Cancer College, and that's very important to the general public, and we need to publicise that. We're involved in every aspect throughout both sets of members on both sides of the college in cancer care and management. So that's right from the original diagnosis through imaging, the biopsy to obtain tissue, the discussion, the informed discussion at multidisciplinary team meetings, the treatment of cancer, often involving radiotherapy, the follow-up of the cancer, and the very large and important growing discipline of interventional cancer care. I also think it's important that we should reach out to GPs and to CCGs in order to streamline patient care, so that they realise that by direct referral to radiologists, particularly interventional radiologists, they can streamline patient care and be much more efficient.
How relevant is the RCR to trainees and, of course, existing fellows?
Well, I think it's very relevant, but I think it could be even more relevant, and it's important that members and fellows really feel that they get value for money from their college. I think it's really important that we publicise widely the very good material we already have on the RCR website. I've mentioned already the future standards of care for radiology. There are also excellent documents on cancer, the cancer workforce, cancer strategy. We also offer bursaries and prizes for medical students, and it's important that medical students actually know about that. I think there's a lot more we can do, and there are two particular areas that I would like to concentrate on. One of those is really to promote the involvement of trainees and junior radiologists and young consultants in our college. I think that will energise the college, and I think it's important that they should have some control over their future destiny. I don't know if many people know this, but in fact you can become a member of any committee of the RCR as soon as you have your FRCR. You don't have to be a consultant. The other area which needs a lot of work and promotion and is a very fertile area for development is e-learning in general and the use of digital technologies. So we want to be able to promote members and fellows benefit from the RCR website throughout the whole of their career, help them to gain CPDs, help them to remain state-of-the-art in terms of their knowledge throughout their professional lives. I think this will take considerable investment. I think that if we can get buy-in and ownership by the majority of members into our college, then there's a huge amount we can do together to improve things for all of us and for our patients.
Nicola, thank you very much indeed.
Thank you.